Well, good morning. For several weeks, I've started my press conferences with an update on the numbers, and today I would like to provide a different perspective on the current status. Today we have 176 new positive cases in Iowa for a total of 3,942 positive cases, and we have 842 new negative cases for a total of 25,338 negative cases. Of the 29,262 Iowans who have been tested for COVID-19, 13% have tested positive, compared to a national rate of 18.4% as reported by the CDC. As of yesterday, 77% of all positive cases were among adults age 18 to 40 and middle-aged adults from 41 to 60. 22% were older and elderly adults from 61 to over 80 years of age, and 1% were children under the age of 18. Also, among all Iowans with COVID-19, 10% are staff and residents of long-term care facilities, 16% are healthcare workers, and 29% work in manufacturing facilities. Today we had no new counties, so our county count stands at 84 counties. As of yesterday, 11 of Iowa's 99 counties accounted for 81% of all COVID-19 cases. 5 counties alone had 52% of the state's positives, and 51 counties had 0 to 4 cases each. 1,492 Iowans were diagnosed with COVID-19 and that have recovered for a recovery rate of 38%. Today, the Department of Public Health has confirmed that we do have one additional long-term care facility outbreak in its Manor Care Health Services in Lynn County, bringing the total to 12 long-term care facility outbreaks. Of the positive cases of long-term care facility residents to date, we have had 65 that have recovered, 84 remain ill, and 24 are currently hospitalized. I also sadly report that we do have 6 additional deaths for a total of 96 Iowans who have lost their lives to this horrible virus. As of yesterday, 85% of all deaths are among older and elderly adults. Again, 51% were residents of long-term care facilities. 12% were middle-aged adults, 41 to 60, and 2% were adults ages 18 to 40. Since Iowa's first COVID-19 cases were confirmed, the Department of Public Health has been collecting data through diagnostic testing and contact tracing that allows us to better understand the virus and its impact on Iowans across the state and to help us mitigate it. And now with increased testing capabilities, we'll be able to target areas of concern early with the intent, again, of minimizing the impact of the virus among vulnerable populations and essential workforce. And the data also helps us identify areas of opportunity. Just as we use data to drive decisions when we close schools and businesses to target our efforts on slowing the virus, we'll also use it to reopen the state in a measured and responsible way while continuing to manage virus activity going forward. We must get Iowa back to work sooner rather than later, and the more we continue to learn about the virus in Iowa, the better we'll be able to balance the health of our people and our economy. As you're hearing at the national level, public health experts are recommending that states increase levels of testing and contact tracing as they prepare to reopen business. Fortunately, our experts at the Department of Public Health have taken that approach all along. And that's why we went ahead and pursued a public-private partnership to launch Test Iowa and significantly increase our testing capacities across the state. When we scale up to full capacity, as I said yesterday, we'll be able to test an additional 3,000 Iowans per day, and that's on top of what we're already doing. And not only will that help us fight the spread of the virus, it will inform, as I said, economic decisions that will get Iowans back to work and life back to normal. In just 2 days since the launch of Test Iowa, we've had over 121,000 Iowans who have completed an assessment, and that is a big component of this process. And testing appointments for this weekend are full. This overwhelming response tells me that Iowans are ready to take the next step to move our state forward and be part of the solution, as they have all along, and that's why we're having the conversations that we're having now. We know that many more Iowans qualify for the testing than there are available appointments at this time. So please know that we're not up to a capacity yet, but after the site is up and running this weekend, we will be able to quickly ramp up and get more Iowans scheduled and more tests completed. So it's kind of a soft launch this weekend, but we're going to be prepared and working on next week and how we start to operationalize what we currently are doing. We've also heard from Iowans who had questions about the assessment process, and I thought it'd be helpful if I shared a few of those questions with you today. So if you've had trouble filling out your height and weight, you weren't alone. It's been, in fact, me too. It's been one of the most frequently asked questions, and here are some tips. Calculate your height in inches and enter only the number. Also, enter the number only for your weight. No words, no letters, no symbols should be entered for either. Others who qualify for a test asked when they would be notified to schedule an appointment. And due to the incredible response of Iowans, we're looking at setting up temporary testing sites to accommodate everyone who has already qualified so that you can get tested as soon as possible. And as I just said a moment ago, we'll be really operationalizing that next week. So we appreciate your patience while we work to meet your needs. An email will be coming soon with more information about how to schedule your appointment. And finally, for those who don't have internet access to take the online assessment, we recommend asking a family member or trusted friend with a computer, a tablet, or a smartphone to help you. If you qualify for testing, you will need to schedule your appointment online, and your QR code for check-in and your test results will all be sent to you, by email as well. So online access is necessary for this process, so again, please ask someone you trust to help. If you haven't taken the Test Iowa assessment yet, please go to testiowa.com. It takes only a minute, and your information will help us fight the virus and bring Iowa back. And finally today, I'd like to end with some good news. The U.S. Treasury has finally provided guidance on how to utilize funding through the CARES Act, and we're still reviewing the data, but it is clear that we can use it to further fund our small business grant relief program through the Iowa Economic Development Authority. And I've asked Debbie Durham to begin funding the backlog immediately and looking at new opportunities to utilize some of the funding so that we can help some of that bridge financing to our small businesses across this state that have been impacted by the COVID virus. So between the PPP, Paycheck Protection Program, through the CARES Act, and through what Iowa Economic Development Authority has been able to do with the small grants, and then with some guidelines that we have now, we'll be continuing to work through that and see where else we can be helpful to Iowa's small businesses and families that are hurting because of the COVID virus. So the past, several weeks have been difficult ones. Our lives have been disrupted, and many Iowa families are struggling, but better days are ahead, and I believe those days are coming. So life might not return back to normal exactly as we knew it. It might be a little bit of a new normal for a while, but that's okay. The COVID-19 pandemic has taught us all a few things about ourselves, and maybe one of the greatest lessons has been a reminder of what really matters. And for myself, there are a few things that I can't wait to get back to. Hugging my grandchildren would be one of them, and getting together with family. But there's also a lot of things that we're going to have to do differently going forward. So I'm sure we're going to all continue to learn and adapt the way that we do things, but that can also be a good thing as well. So hang in there with me. We've still got work to do, but I trust in the spirit, and I trust in the resiliency and just the determination of Iowans. And I know, as I've said almost every day, that we're going to get through this together. So with that, we'll open it up for questions.
Do we have information yet about the modeling of where we're headed with this? I mean, we have seen increases in deaths and increases in cases. Do we get any indication as to where we're going from here? Thank you.
Yes, so thank you for the question. We continue to work by looking at a variety of publicly available data sources, working with our federal partners with the CDC, and working with our state partners here in Iowa to better understand what's happening nationally, as well as how to incorporate what we're learning here in Iowa to help inform those things. And when we talk about modeling, again, I think it's important to keep in mind that it's a helpful tool, but it can change depending on personal actions and what we all do to help limit the spread of the virus. And I think what's also helpful are as we get additional information about what's going on here in Iowa through assessments and through the information we're getting from our local public health and clinical partners, all of that together helps us better understand the resources that we need to leverage and target in specific areas here in Iowa to help protect the health and safety of Iowans and get everybody back to normal.
But do we have any numbers as far as where we're headed from here? I mean, do we have modeling that gives us a future look at where we're going?
We're still working on putting together some Iowa-specific numbers, and when we have that, we'll be making it available.
But that's why, again, this will be really helpful because while Iowans go online and take the assessment, it gives us a good idea of where some of the hot spots might be, where we might see some of clustering. We've seen that happening in some of our processing plants and some of our manufacturing facilities. And so that allows us to really go in and target and then identify, who's positive, who's not, what is the scope of the outbreak, how can we isolate, and how can we start to make sure that we keep these facilities and businesses and manufacturers up and running, but not only maybe reduce some of the capacity, but get them back to full capacity sooner rather than later. So it really, all of the information that we're gathering, so again, thank you, Iowans, for going on to testiowa.com and taking the assessment. It really is going to be just an additional tool to what the Department of Public Health and their team have been doing on a daily basis, but that's going to help drive some of the metrics that we use and will continue to use as we move forward. So as we start to open things back up in a responsible and safe manner, we will be able to, through the assessment, kind of watch and calculate through the state, how that's working, if we're seeing anything flare up, and go right in early and kind of start doing some of that contact tracing and try to get to the bottom of what's happening.
Governor, since we're a week away from the April 30th deadline for one of your emergency declarations, especially as it concerns businesses, can you help people know when you will make the decision about whether to extend that or lift part of it, however you're going to handle that?
Yeah.
And then secondarily, you've talked about you may look at reopening things based regionally.
Yeah.
The Iowa Restaurant Association was talking about they're concerned about that just in the sense that, let's say you pick Okoboji or something where they don't have a lot of cases. Since people are so pent up right now and wanting to go do stuff, everybody may rush there instead of staying back home.
Yeah.
So they're wondering if it'd be safer, even if we had to wait longer, so you could just do everybody at once.
I'm actually going to be on a call with them this afternoon, and they've already sent me some of their recommendations and some of the things that they've looked at and how they can be a partner in talking about reopening the restaurant industry and how we can do that again in a responsible manner, whether it's reduced capacity, social distancing, some of the procedures and policies that we can put in place to collectively work on that. So so we'll talk about that with them. But if we've got some hot spots, we probably need to really be mindful of what we're looking at. I believe that Iowans will continue to be responsible just like they have been. So even as we start to open back up the state and businesses, people still need to be responsible. They need to practice social distancing. When we're starting to open up some of these businesses, we need that taking place in these businesses. And that's how we start to slowly and responsibly open back up the state. But we also need to make sure that vulnerable Iowans, they know who they are. They should still be very mindful. They should still be staying home, especially if you have underlying conditions. Think about when you go out in public, who you're going to have, the number that you'll have access to, do the social distancing, maybe wear a face covering. So we will continue to, recommend that especially our vulnerable Iowans and those with underlying conditions continue to practice the mitigation steps that the department and I and everybody have been talking about for the last several weeks.
And can you just say, can you tell them when you think you'll decide?
Well, so might have some news tomorrow, but we're still working on that. So, and then we'll have, that goes through April 30th. And we're as Dr. Padati and Sarah has talked about. We're working on that right now and looking at different ways that we can approach that based on data and metrics that we have. And remember, I said, you can look at it from a state perspective. We can look at it from a regional perspective. We can also look at it from a county perspective, community, and zip code. So we really are able to drill down in the data and just see what makes sense, where we feel comfortable in doing that, and then continue to watch that, and then we can maybe release it just a little bit more. But Iowans are ready to get back to work. We know that we have to do it in a responsible manner. I mean, it is physical, it is mental, and it is financial well-being, and all of that is a part of the picture. And so we need to work. Think about our labor participation rate that we have here in Iowa. We always have led the country when it comes to workforce in our state, and so that's our very nature. But we know that we have to do it in a safe and responsible manner. So we're balancing all of that as we move forward, and I'm confident that we can do that.
Governor, I was wondering who's going to be staffing the NOMI testing sites, like where are the health workers coming from, and then specifically the one in Des Moines that's opening Saturday, and then when can we expect the new sites to open, like next week?
I can talk about next week if you'll talk about workforce.
Sure, thank you. So we've been working to come up with a variety of partnerships, just as we always have, in approaching, directing resources and making tools available to Iowans related to understanding and also testing around COVID-19. So we're working with area providers, we're working with the resources we have through public health and resources through the National Guard, and taking all of those partnerships together to come up with what makes the most sense for locations and making sure that we're able to provide what's needed for Iowans at each of these various testing sites.
So there's a lot of opportunity for us to partner with a lot of different organizations and even some of our hospitals and some of our clinics, and so we're really walking through that. And that's why, this weekend has been, it's kind of a slow launch. So we'll be at the event center and there'll be scheduled tests on Saturday and Sunday, and that'll really allow us to kind of walk through a lot of the logistics that we have in place. And then, but today we'll take that information and that we've gained from the weekend, and then we'll start scheduling sites next week. So we're even working on that today. So tomorrow I might have even a little bit more information about what that looks like and kind of how we ramp up and roll out the logistics of making this operational. But we have the capacity, to set up in all different areas of the state. And so as we bring in the data and we see those that should be tested, we can kind of see where some of those pockets are at. And that's where it would make more sense for us to go in and set up the test site and really identify an area that we're concerned with. And maybe in some of the other areas of the state where it's a little bit lighter, then there's other ways that we can make sure that we can work with other local area providers and getting them tested and kind of walk through it that way. But we'll be able to provide more details tomorrow.
Okay, do you know where the providers for Des Moines are coming from for this weekend?
I should know that, but I'll get to you afterwards. So it's set up. It's already scheduled. So the Test Iowa, they do all of that. They provide all of the supplies and all the equipment and all of that, and then we bring in the workforce. So I assume it's local, but I maybe I don't know for sure. Okay.
We have a variety of the resources
Okay.
I mentioned, and
Okay.
get that information.
Okay, and then I was
They've
also,
been scheduled, so I just don't know where they're coming from. So I don't want you to think they're not scheduled. I'm just not sure where.
I was also wondering, Minnesota announced it's partnered with the Mayo Clinic and
Yeah.
other local health providers. I was just
Yep.
curious to know if the state kind of pursued a partnership with some of the local Iowa health providers, and why you went with NOMI, a Utah-based company.
Yeah. So, and they have a presence. Qualtrics, talked about the presence that they have here in Iowa, and we have a lot of partnerships and collaborations that's already taking place. So this is diagnostic testing. It's it has an Iowa touch. Is how I actually found out about it. I was talking to Ashton Kutcher on the phone about doing a PSA, and in the conversation, talking with him, he asked if I was familiar with what was happening with Test Utah and some of, how it looked very promising, and it looked like other states should potentially take a look at that. He knew one of the individuals that had been working on that was a friend of his or just a colleague and knew him, and so he said, if you'd like, I'd be happy to connect the two of you. And then we connected in my team and then, started connecting with Utah and the Utah Chief of Staff as well as the Governor of Utah, and we were able to start that conversation and ramp it up relatively quickly. But Iowa is also working with Iowa State University and the University of Iowa on serology testing. And so this is a different, the diagnostic testing is one phase of it, but we're also working with our local universities on the serology testing as well. So there's some really exciting things that we've been working on, and I don't know if you want to add to that or even talk about some of the other things that we're working on.
Thank you. I think I would just add that, again, we recognize that we have a variety of resources and great partners here in Iowa. And so part of what we're doing, not just with Test Iowa, but with our approach all along, has been working closely with and hearing from our local public health as well as clinical providers to help, again, come up with the resources that are available and the things that we have to help provide Iowans, with the best possible way to get them back to regular life. So we do continue to hear about opportunities and continue to take advantage of opportunities to work with those kinds of, other Iowa-specific public health and clinical resources. And, again, it's part of what's so important about a response like this. It's not a single entity. It's not a single effort or a single individual. It really requires such collaboration at the local, state, and federal level across the board, these important partnerships, not just with the entities that I've mentioned, but with Iowans who have been, doing all of the things that we've been asking and continue to stay up to date and continue to do things like share information through the Test Iowa assessment.
James Lunger, the Cedar Rapids Gazette.
Good morning, Governor. You mentioned the guidance from the U.S. Treasury, and I wondered how that would have, whether that money that the state has received, that $1.25 billion, whether any of that will be going to cities that are seeing their revenues dry up, sales tax, hotel, motel receipts are down. Will they get some of that $1.25 billion?
We just got the guidelines last night, so we'll be sitting down with the team and walking through. I mean, we already had some of the anticipated expenses that that has already occurred that we assumed would be covered by the funding, and based on what Mnuchin and the president and the vice president had indicated. They were trying to give as much flexibility that they can. And so we'll sit down and work with the team today and just kind of take a look at what that looks like and how we can utilize the funding, and really doing it in a very, thoughtful and strategic manner. So we just got it last night. We'll sit down today and take a look at that. Right now, none of that money can be used to supplant the budget, so we'll just have to wade through some of the other details that we have and see how that works with some of our local governments.
We'll go to Beth at KCRG. Go ahead.
Thank you so much. Good morning, Governor. I have a question about the Abbott test. 15 of those machines were dispersed across Iowa. I was curious how many of those machines are currently in use and what is their current run rate? How many tests are they able to? How many are they actually testing? How many people are they testing a day? Do you know?
I don't know if I know the day, but.
Thank you for the question. I don't know if I have for you the number of Abbott-specific tests that are done each day, but we do receive, those results. And the Abbott machines have been shared, and I think we've made that information available, and I think the State Hygienic Laboratory is also making that information available on their webpage as well. And those machines just represent, again, when we think about the big picture approach to a virus like this, it's another opportunity to find a way to bring resources to Iowans. And we want to continue to leverage every potential opportunity, every potential resource, and every potential partnership as we all work together to try and, fight the spread of this virus. And the Abbott machines are a helpful resource. They're not quite as high capacity because they're a point of care test, so they may be doing approximately 4 tests an hour, but they're another resource that's helpful. It's a resource that can be local. And again, we continue to work with, our State Hygienic Laboratory on the testing they provide. We work through resources like Test Iowa and all of our providers across the state who continue to work to take care of Iowans and help connect them to resources when they're ill.
Kathy Obranovich, Iowa Capital Dispatch.
Yeah, thanks, Governor. Thanks for the background on how you found Test Iowa. I had a couple more questions about that. One, can you tell us the name of the manufacturer of the tests that Iowa will be using, whether they are FDA-approved tests or what the status is of FDA approval of those tests? And finally, just why wouldn't the state have contacted other potential vendors for COVID testing program before entering this contract?
Well,
Thanks.
Well, first of all, it is FDA approved, so thank you for the question. And it is a collaborative effort that was put in place with Utah, Nomi Health, Silicon Slopes, Qualtrics, and Domo, I think, are some of the players that were involved in that. And part of Utah's role in that was to be a part of actually designing and developing. This hadn't been it hadn't been developed before, so that was part of the connection that they had with that. And so as I learned about this, I mean, testing has been kind of an issue throughout the whole process, and we had been able to increase our testing, but when I learned about the opportunity to have significant access to significant tests, and most importantly, the assessment piece that was tied to it, which is extremely beneficial as we start to open things back up and continue to manage the virus, as we work through the summer and into the fall, to continue to work with Iowans and have them help be a part of our solution and monitoring the virus going forward. I was very intrigued with the capability that it provided. And so I reached out to Gary Herbert, who has been the governor there, who has been, I think they're about 3 weeks into this, was very integral in the helping develop it and set it up. I also had, as I indicated, my chief of staff and my CEO, Public Health, has been involved in the conversations as well. And we were able to stand that up in a relatively short timeline. In addition to that, as Dr. Badati indicated, we have had all kinds of partnerships that have been taking place with our hospitals and clinics and our universities throughout the whole process. And so this is another tool that we will be able to utilize in our fight against COVID-19. And every day we're learning more and more about the disease and how it's spread and how we can continue to mitigate the risk. And so, and we're going to continue to learn every day, just even from the ways that we can test, whether it's serology or whether it's the nasal swab or it's the one that's a little bit tougher to experience, or if it's a saliva test, which is now coming online. I mean, this is, as Dr. Padati said, it's a local, state, and federal and private sector collaboration to really come together and figure out how in a relatively short time frame we can start to just really understand this disease and figure out how we can not only protect Iowans but protect Americans and really, hopefully learn to live with it until we have a vaccine and we can start to get things back to normal.
Got time for 2 more questions. Todd, KCCI.
Governor, can either you or Dr. Bernardi talk about the serology timeline?
Okay.
Is that something that will be done within the Test Iowa parameters, or will you set up some different program, and what's the timeline for doing that?
Yes, thank you for the question. So the serology, again, it's another tool that we have to help us better understand this virus and how we can sort of implement measures to get Iowans back to normal. So I think, as I've said previously, part of what's a little bit challenging is we still have more to learn, and so it's going to be important that as we do the serology, we understand that we still need to fully understand what the immunity or the result correlates to. So when somebody has immunity, as evidenced on a serologic test, we're still learning more about how long that lasts and how strong that immunity is. And again, that's something that we look at for a variety of illnesses, and it's part of what goes into our understanding of things like vaccines. So it's another important tool, and it's something that we've been working both with our state hygienic laboratory and with ISU on increasing capacity and resources. And in fact, we have started to offer some of that testing related to evaluations of high risk or outbreak settings, and it's something that we're going to be continuing to expand on in the coming days.
Last question, Tony.
So one of the things I want to add to that, though, too, is just earlier when we talk about utilizing the different tools, that's one of the advantages. I've also talked about how I'm online with governors all across the state at least once or twice a week, and we are always sharing best practices and what they're doing in their states. And so just like I learned from Governor Herbert, what he is doing in Utah. We were able to stand that up in Iowa. Governor Ricketts is in the process of standing up Test Nebraska. I talked to Governor Lee from Tennessee last night. They're trying to expand their testing. I was talking about what we're doing with serology testing and the partnership that we have with Iowa State University and the University of Iowa. And he said, "Oh my gosh, well, we're not doing that. So you're ahead of us on that, but that's something that we're, that's steps that we're looking at next." That's part of, we talk about the laboratories in the various states across the country. Well, that's what we're all doing, and we're all learning from each other. And if we see an opportunity, believe me, we're all going at it about as fast as we can. So there's just been so much value in having those conversations with governors across the country and learning from them and talking about what we're doing. And collectively, that is how we're going to really start to get on the other side of COVID-19 in the United States. Okay, we'll take the last question, right?
Yep. Tony, go ahead.
Thank you. Governor, I wanted to ask about contact tracing. Who is going to be doing that? How many folks does Iowa need? And is the state going to be hiring people?
So what we're doing, we talked about the National Guard getting a status 32. And with that, we're able to bring on, under federal guidelines, about 1,000 Guard members. So they're being utilized and deployed in a lot of different manners, but that will be a resource. Whether it's state activation or federal, we're still working through some of that, but there's some opportunity there. The Department of Human Services, we're working with other agencies and really reassigning what some of their missions are so that they can be available to do some of the contact tracing. And of course, the Department of Public Health and our local public health officials, they are already doing that. And so they're already doing they're doing the contact tracing with the tests that are running through the state hygienic lab and through the other labs. And so maybe with the Test Iowa, that's where we'll start to utilize DHS, various agencies that have personnel that can help with that, as well as potential help from the National Guard as well. So again, a lot of that is coming together right now, but we know that we're going to have to significantly increase the number of people that are doing that because we're testing. We'll have the capacity to test so many other Iowans, and then the quicker that we can get in and do that, that allows us to really start to slow the spread even quicker than what we've been able to do, identify who's positive, who they've come in contact, ask them to isolate, make them be aware of it, and hopefully, again, slow and really mitigate the spread of COVID-19. So thank you. Got a lot of notes here.